Imagine this. One day, you accidentally cut your finger. It seems like a minor scratch at first, so you just ignore it. But a few days later, it starts swelling up. Then the skin turns purple, dark, and suddenly, one of your fingers starts rotting. You don't know the reason. You're burning up with a terrible fever, and you don't even have the energy to walk around. It honestly seems like you're going to die soon. Then, where do you head first? Of course, now in 2026, you'd immediately visit a modern hospital. You'll meet a professional doctor who will diagnose your infection and provide a precise prescription. If necessary, they'll perform a sterile surgery to fix your problem. In a week or two, you will be completely fine back to your normal life. We take this entire process for granted. But what if you were living in medieval Europe 800 years ago? If you had that rotting finger back then, you would have likely died. Why? In medieval Europe, a hospital was not a place for healing. It was called an infirmary, a religious shelter run by the church where the poor and the dying were packed together in filthy conditions. People believed sickness was a punishment from God or a curse by a demon. There were no professional doctors, no concepts of sanitation, and no real treatments. Going there would only worsen your infection. Then, how did humanity transform these hopeless shelters into the scientific, life saving modern hospitals we have today? Did Europeans figure it out on their own? The answer is no. Today, we're going to delve into how the concept of hospital was introduced to medieval Europe. Let's travel back in time to 9th century Baghdad. Around the 9th century, it was a golden age of Islam. In the heart of Baghdad, a revolutionary concept was born, the Bimaristan. This is a Persian word that literally means the house of the sick. Unlike medieval Europe, where diseases were viewed as a spiritual curse, Islamic scholars viewed disease as a purely scientific phenomenon. Prophet Muhammad famously stated that God did not create a disease without also creating its cure. This powerful cultural mindset drove Arab doctors to search for logical, practical treatments. Most importantly, Bimaristans established a fundamental value. Healthcare was a universal right. Treatment was completely free of charge for everyone, regardless of their religion, race, gender, or financial status. So, what made these Bimaristans so fundamentally advanced? They introduced three radical innovations that actually define our modern hospitals today. First, they invented systematic patient isolation. To prevent infections from spreading, Bimaristans separated patients by their specific conditions. Mental health patients, trauma cases, and those with contagious fevers were kept in completely different wards. Going back to our story, if you came in with that rotting, infected finger, you'd be immediately isolated so you wouldn't infect other patients. Second, they established professional rounds and departments. Bimaristans were divided into specialized fields like surgery, ophthalmology, and internal medicine. Thanks to this structure, patients could receive professional healthcare services. There were even independent pharmacies inside the hospital to compound precise medications. Third, they integrated clinical education with strict science. Large Bimaristans were not just treatment centers, they were elite medical schools. Students learned subjects such as anatomy and pharmacology, and then practiced hands-on training at hospitals. Same as today, isn't it? To protect patients from fake doctors, the Islamic government required students to pass strict licensing examinations before they could practice medicine. This is the exact origin of the medical board exams we have today. It was during this era that the legendary physician Avicenna, also known as Ibn Sina, wrote his masterpiece, The Canon of Medicine. This encyclopedia focused entirely on clinical trials and drug efficacy. This text rejected old superstitions and became the ultimate textbook of healing. Now, how did this advanced knowledge deliver to Europe? Let's look at the specific process. First, how did Europeans came to know about the concept of Bemeristan? There are two factors, battles and libraries. The first contact is related to the Crusades. European knights first thought Muslims as barbarians. In fact, they weren't. As they marched toward the Middle East, they were absolutely shocked by the level of Arab medicine. European soldiers who were suffering from battlefield injuries were cured by Arab doctors using techniques they had never seen before. They returned to Europe and told people there was a medical paradise. In fact, the actual exchange did not take place in battlefields, but in libraries. Muslims and Christians lived together at Toledo, Spain. During the 12th and 13th centuries, Toledo became a center of massive translation movements. Scholars from all over Europe traveled to Spain with one mission: to translate Arabic medical texts into Latin, the academic language of Europe. They realized that if they wanted to advance, they desperately needed the knowledge preserved by the Arab world. After the long translation process, the book, The Canon of Medicine, was written. The empirical data collected in the Bemeristans of Baghdad was written down in Arabic, traveled across the Mediterranean to Spain, and was translated into Latin. This single book was a result of a long travel. It brought a systematic, scientific approach to human anatomy directly into the hands of European scholars. As a result, the way they viewed the human body has completely changed. Now, what happened when this revolutionary book finally arrived to Europe? Let's look at the transformation of European healthcare. The canon of medicine and other Arab texts arrived in Europe. They triggered an institutional revolution. During the 13th and 14th centuries, newly founded European universities, like the University of Paris, Oxford, and Bologna, adopted these translated Arabic texts as their standard medical curriculum. For nearly 500 years, European medical students could study the human body more scientifically and accurately. The superstition of the past began to fade, replaced by empirical observation and systematic learning. This academic shift completely redesigned the European hospital. Until then, a hospital was just a crowded room for the dying to pray. However, since then, hospital became a place for people visiting to live. They began copying the system of Islamic Bemeristans. They began separating infectious patients into isolated wards. They started organizing hospitals into specialized departments. Lastly, doctors became professionals, not barbers anymore. European medical professors started bringing their students directly to the patients for clinical training. European healthcare transformed from a purely religious duty into a highly regulated, professional, and scientific institution. In this video, we looked at how the Islamic Bemeristan had changed the European healthcare system. It is also descended down to the hospitals these days. If it were not for the Bemeristan, you might have died with your finger rotting. The next time you walk into a hospital, get a precise prescription from a pharmacy, or get a surgery, remember this. These systems are not the exclusive invention of the modern West. They are the legacy of the 9th century Baghdad scholars who prioritized science over substitution and viewed healthcare as a universal human right.